Hey, Mind Health Insiders. Thanks so much for your support. Let's begin the video. What do you think social anxiety looks like? It's normal to feel nervous in some social situations. For example, going on a date or giving a presentation may cause that feeling of butterflies in your stomach. But in social anxiety disorder, also called social phobia, everyday interactions causes significant anxiety, self-consciousness, and embarrassment because you fear being scrutinized or judged negatively by others. In social anxiety disorder, fear and anxiety lead to avoidance that can disrupt your life. Severe stress can affect your relationships, daily routines, work, school, or other activities. Social anxiety disorder can be a chronic mental health condition, but learning coping skills in psychotherapy and taking medications can help you gain confidence and improve your ability to interact with others. Symptoms may include excessive fear of situations in which one may be judged, worry about embarrassment or humiliation, or concern about offending someone. So what should one do? Talk therapy and antidepressants can help increase confidence and improve ability to interact with others. Feelings of shyness or discomfort in certain situations aren't necessarily signs of social anxiety disorder, particularly in children. Comfort levels in social situations vary, depending on personality traits and life experiences. Some people are naturally reserved and others are more outgoing. In contrast to everyday nervousness, social anxiety disorder includes fear, anxiety, and avoidance that interfere with relationships, daily routines, work, school, or other activities. Social anxiety disorder typically begins in the early to mid-teens, though it can sometimes start in younger children or in adults. There are so many emotional and behavioral symptoms causing social anxiety. Let us go through all signs and symptoms of social anxiety disorder. 1. Fear of situations in which you may be judged negatively. 2. Worry about embarrassing or humiliating yourself. 3. Intense fear of interacting or talking with strangers. 4. Fear that others will notice that you look anxious. 5. Fear of physical symptoms that may cause you embarrassment, such as blushing, sweating, trembling, or having a shaky voice. 6. Avoidance of doing things or speaking to people out of fear of embarrassment. 7. Avoidance of situations where you might be the center of attention. 8. Anxiety in anticipation of a feared activity or event. 9. Intense fear or anxiety during social situations. 10. Analysis of your performance and identification of flaws in your interactions after a social situation. 11. Expectation of the worst possible consequences from a negative experience during a social situation. These symptoms can change over time. They may flare up if you're facing a lot of changes, stress, or demands in your life. Although avoiding situations that produce anxiety may make you feel better in the short term, your anxiety is likely to continue over the long term if you don't get treatment. Like many other mental health conditions, social anxiety disorder likely arises from a complex interaction of biological and environmental factors. Few possible causes include: 1. Inherited traits. Anxiety disorders tend to run in families. However, it isn't entirely clear how much of this may be due to genetics and how much is due to learned behavior. 2. Brain structure. A structure in the brain called the amygdala may play a role in controlling the fear response. People who have an overactive amygdala may have a heightened fear response, causing increased anxiety in social situations. 3. Environment. Social anxiety disorder may be a learned behavior. Some people may develop significant anxiety after an unpleasant or embarrassing social situation. Also, there may be an association between social anxiety disorder and parents who either model anxious behavior in social situations or are more controlling or overprotective of their children. Let's go through the various risk factors. Several factors can increase the risk of developing social anxiety disorder, including the following points. 1. Family history. You're more likely to develop social anxiety disorder if your biological parents or siblings have the condition. 2. Negative experiences. Children who experience teasing, bullying, rejection, ridicule or humiliation may be more prone to social anxiety disorder. In addition, other negative events in life, such as family conflict, trauma, or abuse, may be associated with this disorder. 3. Temperament. Children who are shy, timid, withdrawn or restrained when facing new situations or people may be at greater risk. 4. New social or work demands. Social anxiety disorder symptoms typically start in the teenage years, but meeting new people, giving a speech in public or making an important work presentation may trigger symptoms for the first time. 5. Having an appearance or condition that draws attention, for example, facial disfigurement, stuttering or tremors due to Parkinson's disease can increase feelings of self-consciousness and may trigger social anxiety disorder in some people. Complications in social anxiety. If left untreated, social anxiety disorder can control your life. Anxieties can interfere with work, school, relationships, or enjoyment of life. This disorder can cause low self-esteem, trouble being assertive, negative self-talk, hypersensitivity to criticism, poor social skills, isolation and difficult social relationships, low academic and employment achievement, substance abuse, such as drinking too much alcohol, suicide or suicide attempts, other anxiety disorders and certain other mental health disorders, particularly major depressive disorder and substance abuse problems, often occur with social anxiety disorder. How to prevent social anxiety? There's no way to predict what will cause someone to develop an anxiety disorder, but you can take following steps to reduce the impact of symptoms if you're anxious. 1. get help early. Anxiety, like many other mental health conditions, can be harder to treat if you wait. 2. Keep a journal. Keeping track of your personal life can help you and your mental health professional identify what's causing you stress and what seems to help you feel better. 3. Set priorities in your life. You can reduce anxiety by carefully managing your time and energy. Make sure that you spend time doing things you enjoy. 4. Avoid unhealthy substance use. Alcohol and drug use, and even caffeine or nicotine use, can cause or worsen anxiety. If you're addicted to any of these substances, quitting can make you anxious. If you can't quit on your own, see your healthcare provider or find a treatment program or support group to help you. If you find this video helpful, be sure to like, subscribe, and share this video with those who might benefit from it, and don't forget to hit the notification bell icon to get notified whenever Mind Health Insiders posts a new video.